Hello, I'm Joanna Benfield and I'm a sex therapist and a relationship counsellor. I'm going to be talking today about erectile dysfunction. Now, this is a problem that strikes fear in the heart of many a man. And for many men, it's something that they will have to face at some point in their lives, even if it's only on the odd occasion. The penis and the erection go right to the heart of who a man is, and it's seen as synonymous with manhood in many cultures. And so when a man is unable to get an erection, this can really strike right into his very identity. And it's for this reason that it's often very difficult for men to cope with the concept of erectile dysfunction. For many men, when they find themselves faced with impotence, their first response will be to Google Viagra and to order some of the little blue pills from the internet. Now, this approach is not to be recommended for a number of reasons. Firstly, there is no proof of what's actually in the medication that you're ordering off the internet, no proof that it is actually Viagra or one of the other counterparts like Cialis or Levitra. Secondly, if you are going to take one of these medications, you need to have it properly prescribed by your doctor. And there are a couple of reasons for that. Firstly, your doctor will need to set the right dosage for you. And secondly, you will need to check that the erectile dysfunction is not the result of another physical problem. So erectile dysfunction can often be a precursor of diabetes. It can also sometimes be the result of certain medications, for instance for blood pressure. And it may be that your doctor is able to simply change your medication rather than having to give you Viagra or Cialis or Levitra. Secondly, by ordering the pills off the internet, you are not really looking at what the source of the problem is. So erectile dysfunction is the tip of the iceberg. So it's there showing you that there's a problem underneath, and that may be a physical problem, but it may also be a psychological problem. Psychologically, there are a number of things that affect a man's ability to get an erection. We tend to imagine that the penis is somehow not connected to the brain, that a man can get aroused under any circumstances. And yet when we think that actually our brain is our largest erogenous organ, then actually what happens in the brain really does affect what happens in the penis. So if a man's feeling stressed about work, if he's having difficulties financially, if he's feeling anxious about any other areas of his life, all of these factors are likely to affect his ability to get an erection. Secondly, if a man's struggling with certain issues in his relationship, this is likely to manifest itself in erectile dysfunction. So for instance, if communication is difficult in the relationship, if the man is worried about his partner leaving him, if it feels as though the relationship is breaking down in some way, all of these factors can have an impact on the man's ability to get an erection. And it's very important, if you feel that these kind of psychological issues may be affecting you, that you go to see a sex therapist to talk them through properly. If you try to self-medicate by taking Viagra or taking one of the other counterparts, all you're doing is dealing with the symptom, you're not dealing with the cause. And actually, it's likely to manifest itself in other ways. And that might be through other sexual dysfunctions. Or it may be that you pull away from sex in another way. So please, if you are struggling with this problem, please do go and see a sex therapist, talk it through with them. If you would like to come and see me for an initial consultation about that, you can have a look at my website and you can give me a call or send me an email. I see clients face-to-face in London, in Monaco and in the south of France, and I also see clients worldwide via Skype. So please don't struggle with this problem by yourself. Do go and see somebody and talk it through properly. Goodbye.